This debate over when to reopen, pitting economic concerns against public health.
It is 50 states with 50 plans, many of them allowing more activity, more interaction.
When and how to reopen parts of the economy have become highly charged political issues.
As coronavirus lockdowns begin to be loosened across the country, and people begin returning to restaurants, offices, and outdoor spaces, memories of the past are starting to echo in the present. It's not the first time the U.S. has grappled with the question of when to reopen after a deadly health scare. The flu pandemic of 1918 infected a third of the world's population. Though several deadly flu outbreaks have followed, it remains the deadliest on record, killing an estimated 50 million worldwide, and over 500,000 in the U.S., according to the CDC, all of which played against the backdrop of World War I.
The pandemic started in military camps, first and foremost. So the military worked to try and control those epidemics in the camps, and these camps, a lot of them were located right next to American cities.
Dr. J. Alexander Navarro of the University of Michigan Center for History of Medicine was part of a team of researchers that asked a key question about the 1918 flu pandemic. Did implementing non-pharmaceutical interventions like social distancing, school closures, bans on public gatherings prove effective in saving lives while developing a vaccine?
We studied 43 American cities. They were the largest American cities at the time. And what we found is, based on our historical data and the statistical analysis, is that cities that implemented these NPI, these non-pharmaceutical interventions, early in a layered fashion, so that's what we're talking about, layering multiple interventions, and in a sustained manner, so kept them on for longer, those cities fared better.
Statewide closure orders, mandatory mask ordinances, and other forms of mitigation were widespread. Cities like San Francisco even imposed fines on individuals failing to wear a mask in public. Though one of the main differences between 1918 and 2020 is the importance of the service industry for the modern economy.
Economic life was a lot different then. Today, the ways in which the disease is spread, those are going to impact and have impacted the service sector jobs more than anything. We have, this is an economy that is built on the service sector. So I think we're in for a much greater and more severe economic impact today than we were in 1918.
The fall of 1918 was the deadliest period in the pandemic in the U.S., right as soldiers were returning home and supporting the war effort was at an all-time high.
The historical context here is daily life was heavily impacted by the war effort. And so the average Joe in the fall of 1918 was very much preoccupied with things like the Liberty Loan drives. So the idea was to get as many subscriptions. Each city had a quota of money they needed to raise.
Philadelphia's decision not to cancel its Liberty Loan parade in late September resulted in 1,000 deaths in the span of 10 days. Other cities like Denver lifted restrictions that November on Armistice Day to celebrate the end of the war, only to experience a deadlier spike.
Thousands of people flock to downtown. They go to movie houses and theaters and auditoriums to hear lectures about the end of the war. And almost instantly, within a few days, there's another huge spike of cases, and then shortly thereafter, deaths. And that second spike is actually deadlier in Denver and a few other cities than the first spike of cases.
The advances in medicine, science, and technology have made the 2020 landscape vastly different. But the same behaviors might still ultimately persist, even with guidelines from the CDC.
Even though the historical context changes, there's going to be a great clamoring to get back to life as normal. And although epidemiologically, the virus and the pandemic are going to be with us for some time, that's not the only definition, unfortunately, of a pandemic. That's the scientific one. But if society determines there's no more epidemic, despite the fact that people still might be dying, if they feel that there's just the risk is worth it, people are going to go back to life as normal. And there could be really terrible public health consequences as a result.